Hello, so tomorrow's the big day. I'm sure you're excited, but also definitely feeling some nerves at this point. That's totally normal, but you're in good hands. We're going to take good care of you, and hopefully make this process as simple as we possibly can. So a few things, some pointers to know. So first off, nothing to eat or drink after midnight tonight, including water, but it is totally fine to brush your teeth tomorrow, so that's good for all of us, but that's fine to do. Other thing is the showering. So make sure that you shower your whole body with Dial soap tonight and in the morning before you come in for surgery. And then your medications, as we talked about that during the pre-op. There's certain ones that you can take with a sip of water that morning is totally fine. There's a few that we leave off, so we will have already talked about that. But otherwise, just a sip of water is totally fine. So then we'll see you tomorrow morning at the surgery center. If it's at the Sacramento office, then you'll go upstairs, either through the elevator or the stairs. There's a double door, there's a doorbell, you'll ring that, the nurses will come out to greet you. If you're at the Granite Bay office, it's on the first floor. You'll go through that little glass door that says Surgery Center, and then there's a doorbell there, and the nurses will come meet you as well. They'll get your ride's information, and they'll call them afterwards to let them know what time to come pick you up so that you'll be all good to go on that. But then the nurses will take you back, they'll take you into the pre-op area, they'll ask you a bunch of questions, you'll fill out a bunch more paperwork. I'm sure you're sick of that by now, but you'll have a lot of paperwork to fill out and get all ready for that. They'll place an IV in and get you ready for surgery. They'll put your clothes in a certain location, keep all of that. You can bring your phone with you, that's fine. We also have iPads, you can watch movies while you're waiting, that sort of thing. Key thing to know too, time. My patient coordinator would have given you that time to show up for. Just know that may change. That may change the day before. That can even change the day of. So keep your phone on all night long and all morning, because we may call you and tell you, hey, we need you to come in earlier for a certain reason, so just be available for that. But then in the pre-op area, you'll see me. I'll come back, say hello. For certain procedures, I do some markings. For others, there may not be any markings that are necessary. Definitely for all general anesthesia cases, we'll talk beforehand. Some of the sedation cases, there may be, you may not remember that we talked, because you'll get some sedation even early as they're kind of getting you all ready. And so I'll come in and say hello, but you may not remember, but I definitely am there. So we'll go through all that point. Any other questions you may have, always feel free to ask me, make a little list, anything like that. The anesthesiologist will also come talk to you if we're having general anesthesia. He or she will go through everything from their standpoint. Then we'll go back and we'll do the surgery and go from there. It'll be a blink of an eye for you, but it may take a little bit longer than that, obviously, in real life. Then you'll spend some time in the recovery room. And then once you're up to it, which ranges anywhere from about 45 minutes to 2 hours, depending on things and how you're doing, then you'll let you go home. And then we'll go from there. So that's basically what the day's going to entail tomorrow. So I think you'll do great. Try to get some rest tonight. We'll give you some medicine that will help with that tomorrow for sure, and make things a little easier. But we look forward to seeing you. Give Robin a call today. If any last minute questions come up, you can always get in touch with someone, and then we'll go from there. Look forward to seeing you tomorrow.